Digital Reflections presentation, Addiction as a Disease, by Hannah Berkowitz. Is addiction a disease or a choice, and why? Based on people's personal accounts, evidence-based research, and the way a person's brain behaves once a substance is introduced to their system, it is evident that addiction is a choice because no person could or would become dependent on a substance of their own volition. I am a person in long-term recovery from substance use disorder. In addition, I work in the recovery field and I work with people every day who struggle with alcoholism and addiction. This topic is one that is close to my heart in my own sobriety. Dopamine and serotonin are two chemicals that can greatly affect a person's happiness and their mood. Dopamine is the chemical in the brain that can affect how people live their daily lives. One of dopamine's functions is helping with reinforcement. For example, when someone has a slice of pizza and they keep going back for more, dopamine plays a large role in that behavior. So when people use drugs and alcohol regularly, they deplete themselves of the dopamine and serotonin that their brain naturally produces. And the brain of an addict actually functions differently than a normal person's brain when it's introduced to drugs and alcohol. Addiction can be classified as a chronic disease because although the symptoms are treatable, there is no known cure. Addiction is a chronic disease just like diabetes or heart disease. The National Center for Chronic Disease Prevention and Health Promotion defines a chronic disease as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. Under this description, addiction does classify as a chronic disease. It is common for young people in the United States to experiment with mind-altering substances. Unfortunately, a small handful of people who experiment do become addicted. The 2015 National Survey on Drug Use and Health indicated that 33% of 15-year-olds reported that they have had at least one drink in their lives. Approximately 5.1 million people ages 12 to 20 reported binge drinking in the past month, and approximately 1.3 million people ages 12 to 20 reported heavy alcohol use in the past month. There are many people that might argue that addiction is a choice or it is a learned behavior rather than a chronic disease. Addiction involves choice just like diseases like diabetes or lung cancer. Just because the disease of addiction does involve choice does not mean it can't be classified as a chronic disease. The brain disease model of addiction shows that people's brains can dictate how they behave, and it shows that addiction is a disease. This is a solution because it can reduce the stigma. In conclusion, due to the overwhelming evidence, including the science relating to the brain and chemicals like serotonin and dopamine, and the emerging science of the genetic role of addiction, it can be concluded that addiction is not a choice. When people choose to take the first pill, drink, or hit, it's often assumed that there is no disease involved, but the literature that I've cited suggests that the disease of addiction is more complicated than that. Some of the things that I have learned while doing research on the paper are that experts have differing opinions on the brain disease model of addiction, and this is not to say that anybody is more of an expert than the other, it's just that they have different evidence to back up their claims. And the other thing that I've learned is addiction is not a black and white issue. There isn't one solution that's a cure-all. This course enabled me to learn to manage my time better. When I got all of my assignments at the beginning of the week, I had to figure out where I could best utilize my time in order to do the best that I could. In addition, I enjoyed challenging myself to work harder, and this course really taught me that the things that I was most afraid about of college, I'm actually capable of doing if I break it down in the correct way.